It's time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
Hi folks, I'm Sam Lesante. Thanks for joining us. Remember folks, if you have an HD TV, tune us on channel 513 now on the HD channel, Service Electric Cablevision. Another great show for you today, talking about health. What do we know about occupational health services? And also, if you're traveling someplace, what should you know about the water? You should have certain medicines. Should you get certain preventative needles that you may need when you go to a certain area? We're going to talk about that today because I have on the show Joseph Aquilina, who is the Corporate Outreach Liaison, and Dr. Michele Kowalski McGraw, who is an occupational health physician. Now, Michele, you were on the show before talking about stress. I did pretty good with that stress. Okay, relieve my stress, Joseph. Yeah, interesting show. And it's interesting how you talk about different things that that affect us. Okay, Joseph, how are you?
Good, Sam. Good to be back here.
I haven't seen you in a while.
Yeah.
You're looking great. I love this shirt, love the tie.
Thank you.
That's probably at this
for your show.
Thanks very much. So I'm going to give you a cup for that.
Yes.
Okay. Joe, tell me a little bit about yourself.
Well, it's interesting. Years ago, I completed a graduate degree in exercise in cardiac rehab. That was in August of that year. In October that same year, our local hospital was looking to develop a fitness center and cardiac rehab center. So I was hired 2 months after graduation, and I moved here. And your viewers might remember we started our fitness and cardiac rehab center in the old Item Cadillac building on Route 309, the second floor. That's where it all started. Yeah. And then several years later, the fitness center and cardiac rehab moved to 15th Street.
Yeah.
And then our department saw a need for developing a formalized occupational medicine program for area businesses and employers. So we started that at the hospital. Now those services were always available through the ambulatory care center at the time, mm-hmm. but it was growing and they needed to have a formalized program. So Dr. John Metler, myself, and some other managers put together that program, and that's where it all started at St. Joe's.
Yeah.
And now we're based many years later at the Health and Wellness Center.
How these evolve, huh?
Yeah.
Yeah. I was only 2 years old when it was an item, so I
You don't remember that?
I don't remember that. Joe, Occupational Health Services. For those people, we were talking about, it's a big umbrella, okay?
Right.
Define it for me. Just give me a description of occupational health services.
Well, it's any service that a company or an employer, as I said, even a small business would need. We're a resource for companies. That's all we do. We don't see patients who have flus or colds. It's everything related around the workplace. So we start with, Sam, almost 100% of companies now do pre-placement drug testing. It's almost a given if you're going for a job. So we do the drug testing at our clinic. Some companies do pre and placement alcohol testing. Then many companies do physical exams before they hire someone. They make a job offer, but it's contingent upon them passing the physical. Mm-hmm. The reason for that is when you start a job, you should be able to do some essential physical job essentials, some physical components. So the physical that we do helps our doctors help evaluate to see if this applicant can do the job essentials. Because employers want, they don't want their employee to get injured at work, and employees don't want to get injured. So those pre-placement exams help with the placement, making sure that the person can do the job essentials. And we're jumping ahead, but we also, if someone does get injured, we do treat the work injuries. Mm-hmm. And Michelle's going to talk about some of the common work injuries. And then the other big thing we want to talk about is prevention.
Which is key.
It's key.
Yeah. Anthony, or Joseph, I'm sorry. When you're looking at employers today, the workforce is open to many different age groups, okay? And so we have a lot of talented people out there who are in their 50s, okay? Maybe they lost their job and they're still able to work. So now, someone applies and mid-50s, and we need to find out if they have the health, etc. Do you deal with if an employee needs some guidance in those areas, Michele?
Yeah, that we do quite often. That's a fitness for duty exam, and you're right, Sam. We are seeing more and more people re-enter the workforce or change jobs, have a second career. So this is where occupational medicine as a specialty really comes in. Some jobs they can do great, and they may be a real asset to the company. But you have to look carefully at what kind of work they're going to be doing. You have to be very familiar with the workplace to which they're going to make sure that they're safe, and that also that they don't endanger anyone else if they can't do the job. That's where, as a specialty, occupational medicine is different from other specialties, and that it really is based in populations as well as individuals. It's a public health, preventative medicine sort of thing. So we take a look at the big picture, whereas if this person just went to their regular doctor, they may know that person's health, but they don't know about the workplace to which this person is going.
So occupational health physician, okay, so now you have a medical degree, right? Okay, so how did you become involved with that? I mean, so you go into that direction.
Right, it was interesting. Joe actually started asking me to cover the occupational health clinic when I was working in the...
I watched that, Joe. He
That's
gets you
right.
involved in a lot of things.
Yeah, he did. He got me into this, but I was covering the emergency room at St. Joe's and Hazleton General. I'm trained in family medicine originally, and he would ask me, for cover for a day here, a day there. I found I really loved it because it is preventative medicine. So I wanted to learn more and more about it. We can really, the neat thing with occupational medicine, we can see what's causing a problem and try to fix it. So I learned as much as I could about it. I recently went back and got my board certification in occupational medicine, preventative health, and I kind of never looked back from there.
So what type of medicine is the best kept secret here? This is interesting because everyone wants to know what is the best kept secret in medicine?
Yeah, Joe and I were just talking before. A lot of times people ask us, what type of medicine do you do? And we tell them occupational medicine. They say, what's that? Is that occupational therapy?
Yeah, exactly.
So that's what the big confusion is a lot of times. We do a lot of the same things as occupational therapy. We want to keep people functional, keep people working. But I think occupational medicine as a specialty, in this country at least, is relatively new. It started way back in the 1600s when Ramazzini just wrote this book that he was an Italian physician, and he noted that certain diseases appeared in certain workers, and that also people that didn't work also had problems. Maybe they were less healthy than the people that did. So in Europe, it's been around for a long time, but in our country, it really gained traction like in the 80s when companies like IBM or DuPont started to realize that they had a lot of people whose health could really affect their productivity. So they said, hey, if we take a look at these workers' health, maybe consult some physicians how we can keep our workforce healthy, that's going to go to our bottom line. And sure enough, it did. Those companies that used occupational medicine noted increased productivity. So other companies followed, and that's where we are today.
Does care affect more than the patient you are seeing?
There was an interesting study that came out, and that was that this one occupational health clinic saw approximately 700 patients. Of those 700 patients, 1,400 were affected directly when the person went back to work and, let's say, had restrictions. They couldn't, lift certain things, so then somebody else had to lift those things. When they changed policies based on, okay, this person got injured here, let's not do this anymore, changed the policy, then it was jumped up to 14,000 people were affected. And when they looked at how that affected the community and the families that these workers belonged to, it was 21,000 people. So you can see what we decide in occupational medicine affects not just the patient that we're seeing, but certainly far-reaching effects.
We're going to go for a break, but after we come back for a break, I want to talk about how do you assess? I mean, what would be the assessment of people who have any kind of a workforce in the workforce? Because I'm sure there's severities. The different companies may have computers, maybe doing physical, so there's different things you have to assess. Folks, I'm talking to Joseph Aquilina, who is the Corporate Outreach Liaison for the Health Services, the Health and Wellness Center, Hazleton. If you want to contact them, 570-501-6805, and Dr. Michele Kowalski McGraw, who is an occupational health physician. Very interesting. Remember I talked about if you're traveling, what you should know about traveling in medicine? We're going to talk about that when we come back too. Stay with us. Thanks for staying with us, folks. Remember, 24/7, you can watch all of our programs on ssptv.com. All of the health shows are there. And my email, folks, is sam@ssptv.com. And remember, if you are on Service Electric Cablevision, you can now watch us on Channel 513, high definition. And thank you, folks, for all the great comments we're getting on our HD channel. Today, folks, we're talking about occupational health services. Now, it's going to be very interesting because we're talking about if you're going to travel someplace, you're going to find out some interesting things. Joseph Aquilina, who is the Corporate Outreach Liaison, and Dr. Michele Kowalski, McGraw, who is an occupational health physician. We're talking about different things. And now, Joe, what are the services that are offered by by your medicine clinic?
Okay, we talked briefly earlier about drug testing and the physicals, and our next service is treatment of work injuries. So we treat most types of work injuries. Michele will talk about them a little bit later, about muscle strains, minor lacerations. Serious injuries do have to go to an ER, but we treat most of the non-serious work injuries.
Joe, do you, if an employer calls you, and let's say they have a program working, they have their drug test, etc., but maybe the nature of the business that we have, whether it's manufacturing, whether it's whatever the case, if I would say, I want to see if everything we're doing is right here, okay? Do you come in and do an assessment of our company?
Yes, we do two things. All of our physicians visit the businesses, the companies locally for a walkthrough, and sometimes they do see some workstations.
Yes.
That they might be able to suggest some changes to make it safer. The other thing that we have available at the Health and Wellness Center is we have an industrial rehab department that we work very closely with. They're occupational therapists that go to the work site and do job strain analysis. They analyze the workstation they have measurements and formulas to see the risk for that particular job station causing an injury, and often they prepare a great report.
When I did the show at the health center a couple of years ago, we showed that area.
Right.
And where they come in, they actually have tools and they have different things where they work with, which is very interesting. The common work area injuries that you find, Michele?
I would agree with Joe. Because we have a lot of manufacturing and distribution in our area, we see a lot of muscle injuries, knee problems, shoulder, back. But we also see certain exposures, heat, cold problems, burns, some chemical exposures, whether they affect the lungs or the skin. And then again, like Joe said, if there's something very serious, we send them to the emergency room first for stabilization, and they would follow up with us. But the follow-up's the neat part, and that's where we work closely with the people that do the job strain or make recommendations on how to make it safer. When there's an injury, we don't want it to happen again, and neither does that company. So we can work with them on seeing, okay, what caused it and how can we make it better? And even more importantly, did work cause it? Because sometimes you don't want to be chasing something to try to fix something that you can't fix within the workplace that maybe should be addressed elsewhere.
Okay, so let me throw something at you here, okay? Don't mean throw something at you, but throw something at you. Every employer, I know I do, I want my people to feel good when they go to work. Okay, I want them to feel, I feel sorry for people who get up in the morning and say, I got to go to work, and they hate their job, which is sad. So now we go into work and we want to keep them healthy. But there are some people that have emotional problems, okay? That can affect your, what you do on a job. So do you ever get into the point where you may be addressing people with emotional problems?
Often. That certainly is plays into it quite a bit, because what comes into the injury is the relationship of the employee and the employer. And like you said, most employers, they want to have a good relationship. They want to build that good culture that people, love. And people spend a lot of their time at work. That's where their friends are. That's, studies show that if they do continue to go to work and make friends, they're healthier over their lifetime. So you want that good relationship. But, things get in the way of that. And we can address some of those things. We do on a population level the stress management programs that I talked to you about on a previous show. And then we look also, again, very carefully at what the issue that they're bringing to us is. Mm-hmm. Is it really about their back, or is it about a relationship with their supervisor?
That's very interesting. I mean, so that's why I said when you're talking about assessment, we always try to do a little bit better every day. if we could do 3% or 5% better, and to keep an attitude, a positive attitude, there's all these different facets that go with it. So prevention, Joseph, is really important, okay, when it comes to occupational medicine. So that's interesting, because when you're talking about the occupational medicine clinic, and we think of the occupational medicine, that prevention part, again, stress to me that prevention part, Michele.
That's the core of occupational medicine. It's actually a subspecialty of the Board of Preventative Medicine, because the goal is to try to identify things in the workplace that may be a problem, and also to create positive things in the workplace. So prevention is the key, and that's where we're getting a lot of momentum as a specialty, because with the changes in medicine, we're realizing an ounce of prevention is worth a pound of cure. It's much easier to try to address problems before they happen.
In your experience so far, Joseph, in the Occupational Health Services, going to different places, could you give me some, without mentioning people's names or companies' names, what you've seen and what you've been able to accomplish, via Michele or the various doctors to improve the workplace?
I think one of the key things is, again, looking at the workstations and how to make the workstation safer. The other component that our center offers is proper body mechanics training, that's a prevention. What we do is our therapists go to the workstation and teach the employees proper lifting, so that they can prevent back injuries. They'll also go to the actual workstation and show them how maybe they can do the job with better ergonomics to prevent injuries. So that's, I think, is a big thing. And we're also teaching, a lot of companies are now doing stretching exercises before their shift, during break, at lunchtime, to prevent injuries. So companies are getting on board with prevention, with preventing work injuries.
Now, do I have to have a certain amount of employees before I call you?
No, I'm glad you asked that. We deal with several hundred companies, employers in the area. Some have 5 employees, some have 300. So no matter what size the business is, you can contact us.
And what have been some of the companies that you've been involved with, and without mentioning their names, what have they said to you, Michele, about, after you've been able to assess and go through the process of helping them? What?
I think just by the mere fact of companies using us, the employees sense that their employer cares about them. They want to make them healthy. And so, I get feedback from the patients. The patients I see are amazing. They're very hardworking. That's what keeps me going. I'd love to be involved with that. But they like the fact that, the company is looking out for their best interest. And Joe was saying the companies are actually becoming more and more receptive to the workers' input too, for prevention. These people are the ones that are doing the job. This is one specialty in which the worker actually knows more than I do about how that job's done. So, we need to listen to them, and I think having their input valued is huge.
Speaking of when you're in there assessing them, sometimes the discovery of finding out that a person may have a certain injury or a certain concern about maybe back, but have you ever found that when you do further treatment, there may be something else? It may be another area that's causing a problem, a health problem, has that ever happened?
Yeah, that does happen too. And again, that's where the causation is so important, because we want to try to fix what's broken, but if you can't find it, if there's something else complicating
that's where
it.
Prevention is so very important.
Right.
Talking to Dr. Michele Kowalski, McGraw, folks, is Occupational Health Service at the Health and Wellness Center. The number up there, 570-501-6805, and Joseph Aquilina, who's the Corporate Outreach Liaison. Now, I promise you, Travel Medicine Services. You going away? You want to stay with us. Be back after this. Thanks for staying with us, folks. I'm Sam Lesante. You're watching the Sam Lesante Show. We're talking about Occupational Health Services, folks, with Joseph Aquilina, who is the Corporate Outreach Liaison for the Health and Wellness Center in Hazleton, and Dr. Michele Kowalski McGraw, who is an occupational health physician. Now, people are going to be traveling. So what is travel medicine? What does that mean?
Travel medicine is an environmental medicine, touches on occupational environmental medicine. And the neat thing is that we can really look at what's going on all over the world to see how we can advise people to be healthy. Again, stopping problems, hopefully, before they develop. We started our travel medicine as part of occupational medicine, when people had to travel with their company to these exotic locations. I was just telling Joe, for instance, I get like engineers that have to go to Africa to build the roads or the mines. So we were offering that, and then we realized there was a need in the community for people that just wanted to visit these places, maybe go on a safari or do a student trip. So now we have a travel medicine clinic, and that is where I would identify, I would be the person you would see. I would identify your health profile, where you're going, what the risks are, and match the two up. What vaccines do you need? What medicines do you need? What else can I tell you so that you won't have any problems when you're there?
You know, it's interesting. A friend of mine who is services major companies is in Nigeria. He's doing work in Nigeria. Another friend of mine is in, I forget the place in Africa, and another people that they travel a lot. And geez, I wish I would have known when I was talking to my friend. I bumped into him. He said he was going to Nigeria to work. But sometimes, again, you could say, well, this is what is needed here, and so you know what the certain vaccines are required. Some areas, like southern parts of Africa, I forget the coast, but they advise you not to go there. So I mean, there's areas that you tell people like what.
That's another big thing. You have to stay in touch with what's going on at that moment. Actually, before I go into the room to see a patient for a travel consult, I'll look online to see if anything came up in the last hour, because the CDC will publish travel alerts. Certainly when Ebola was a big deal, they were telling you not to go to parts of Africa. And now with the Zika virus, there's cautions pretty much all over, in the Brazil and other places where this is a risk. So you have to stay very much on top of those things. And some things we can have vaccines for or medicine for. Some things you just have to be aware they're there and try to make yourself as healthy as you can, so that you're less susceptible to it. And then also when you return home, if you were exposed to something that you need to get checked.
Should I be concerned if I have tickets for the Olympics? How concerned should I be on a scale from 0 to 10 whether I should go to the Olympics?
Well, I'm assuming you're not pregnant. So.
I don't know. I have to check with my wife. Oh, so is this only for people who are pregnant?
Yeah, so the big danger is pregnant women. For most people, again, if they're fairly healthy in general, they can resist. It's a mosquito, so if you get a mosquito bite, sometimes it may make you a little bit sick. Hopefully, if you have a good immune system, you'll fight it off. The problem they're finding is, again, with women, and women don't always know they're pregnant, when they travel. And it's if they get bitten and get this virus, then it can cause some pretty serious birth defects.
They have nothing now for vaccine, or they have nothing?
No, they're working on it.
Well, how are they treating these people?
Basically just close monitoring. And again, that's the big thing to remember is, say...
Well, how do you know if you get bit by a mosquito until...
Right, and many times you do get bit when you're in these...
You get bit by spiders, you know, until the next day you see something swollen on you.
Right, so we encourage people, if they're at all concerned, to get checked with their doctors, specifically fever, or say you were just in Brazil and you're coming back and you can't shake this fever, or you're not eating anything, then that's a sign that we can help you. In this country, we have very great medicine, maybe just some IV fluids.
If I'm traveling, I'm calling you up. I'm telling you that right now. Folks, if you're traveling, you want to give Michele a call, 570-501-6025. Well, Joseph, we got about 30 seconds left. Anything you want to say in closing? It's always nice seeing you.
Oh, thank you, Sam. No, we appreciate being on your show, and I think we enjoy the diversity of occupational medicine in terms of we run the gamut from prevention to treatment and just to travel medicine. So we have a lot to offer in our clinic.
You know what I appreciate when I bring people like you on the show, and Michele? I sense the passion that the both of you have. Okay, it's not like a job. That's the great thing about the Lehigh Valley Health Network. Every doctor and anyone that Lisa, Tammy bring on the show, whether they're chiropractors or aides or nurses, etc., they love what they're doing. They're involved and the passion is there. And it's in their slogan here, a passion for better medicine. I mean, it couldn't be any truer. So thanks for coming on the show again. Always nice seeing you.
Same here.
Thank you very much.
The number is 570-501-6805 for you employers out there. You may want to check them out. You can get them to do an assessment of your company. What do you got to lose? Nothing. See you next time.